Good morning. So, in summary, we'll see about the what are the defined antiarrhythmic drugs already we have discussed and their clinical use and adverse effect. Now, class one. So, mechanism already you have to sodium channel blocker, intermediate kinetics, potassium channel. Some cases they may also block. There is some evidence it is there. Though mainly we have discussed there the potassium channel blocker. These are the drug like quinidine. So what is their clinical use? Ventricular arrhythmia, prevention of the paroxysmal recurrent atrial fibrillation. Again, it is one of the important effect. Then conversion of the atrial flutter and fibrillation. So these are the clinical use. And what is the adverse effect? QTP or the torsady point, nausea, diarrhea, hepatotoxicity, myelosuppression, lethal ventricular arrhythmia for the prolonged use of the more dose it can be happen. So this is about the clinical use and adverse effect of the class 1A type of the drug. 1B, again you can say that first kinetic sodium channel blocker, repolarization is shorted, and lidocaine type of the drug. So in case of the ventricular tachycardia or fibrillation, these are the drugs can be used. Says the tremor, confusion, these are the some sort of the adverse effect associated with this type of the drug. One, see, this is very, you can say that causing the strong blockage into the sodium channel. So no effect on the depolarization, we can say that. And this type of the drug, prevention of the paroxysmal atrial fibrillation, recurrent arrhythmia of the abnormal conduction. So these are, in these cases, this type of the drug it can be used post myocardial infarction or pro arrhythmic heart failure. These are the some adverse effect which is associated with the 1C type of drug. Next is beta blocker. Beta blocker like propranolol type of the drug. This is again, propranolol is a non-selective drug and atenolol is a selective beta one. So reduce myocardial infarction, mortality, prevention of the reoccurrence trachyarrhythmia. So this is clinically reduce myocardial infarction mortality and prevention of reoccurrence trachyarrhythmias. What is the adverse effect? Bradycardia, hypotension, fatigue, depression. Now class 3, this is the potassium channel blocker, sabotatol type of the drugs are there. So Wolff Parkinson White syndrome, ventricular tachycardia and fibrillation. Yes, in that case these are the drugs it can be used, and they can be used as a pro-arrhythmic, QTP, torsady points, bradycardia, heart failure. Next is calcium channel blocker. Calcium channel blocker, it may be used into the hypertension as well as the different sort of the arrhythmia associated with the hypertension, bradycardia, and adverse effect is bradycardia and hypotension. So these are the different antiarrhythmic drugs and their effect. So these are the some of the references which you can go through.